Welcome back to Daytime. The science of medicine to make people look younger and better is improving all the time. Standing by on location at the Dr. Matta Cosmetic and Weight Loss Clinic is Daytime's Brian Magibat with Dr. Matta about cosmetic procedures and looking younger with Restylane.
Thanks, guys. I'm at the Dr. Matta Cosmetic and Weight Loss Clinic in Brampton. The perception of beauty has changed over time, but the perception of youth has always stayed the same. Someone says you look young, you're going to take it as a compliment. Here at the Dr. Matta Cosmetic and Weight Loss Clinic, they'll help you do just that. Take back your youth. And joining me here today on Daytime is Dr. Matta himself. Thank you for joining me here today.
Thanks for coming.
So tell us basically what happens to the aging face.
Well, a few things. One, we start to develop wrinkles, whether they come with rest or at rest or with movement. And two, we get the 3 Ds of maturing, which is deterioration of skin quality, descent, and deflation. So things that were once up here have decided to make their way down, and they just sort of slowly absorb.
Okay. And which procedures do you offer here at the clinic that will rectify these problem areas?
Well, for what we call dynamic wrinkles, which are the wrinkles that come with movement, like the frown and the smile, we use Botox, and that helps to relax the muscle action that creates those wrinkles. For the what we call volumetric restoration, so to plump up the cheeks, to get rid of lines and folds that are there at rest or they're deeper and can't be treated with Botox, then we use Restylane or Perlane to help restore that volume.
Okay, so Botox and Restylane, 2 different things.
Completely different. People often ask what the difference is, and Botox will work specifically on the muscle that is causing the wrinkle. So if the wrinkle is there even at rest, Botox won't get rid of it. You do need to fill it with Restylane or Perlane. And Restylane and Perlane are much more commonly used for the lower face to add the volume that has disappeared as we have matured.
Okay. What do you normally tell potential patients who aren't sure if they want to get this procedure done? Why would someone want to go through this procedure?
What they're trying to get is a comfort with their face. So when they look in the mirror and they say, you know what, I'm not happy with what I see, it doesn't reflect who I am in my mind, then these procedures can help with that. If someone were to ask me, would you ever do cosmetic procedures on yourself 10 years ago, I'd say, are you kidding? That's not for me. But I've had Restylane, I've had Botox, I've had Perlane. Currently, I have about 10 treatments of Perlane in my cheeks.
Aha! You're not only the president, you're also the client.
That's right, and you know it's probably my favorite thing to restore the cheeks that I had when I was a kid.
Mm-hmm. And we have Linda here in the chair right now.
Yes, Linda is a 46-year young lady who has a couple of concerns, and she's had some treatment done in the past about a year ago with some Restylane Perlane. And what we're going to talk about are the things that bother her. One, specifically today, we're going to be doing Restylane and Perlane, a combination of the two. One, to restore the volume that she has lost in the cheeks here, and to fill in these folds here, and also to improve jowl correction, or the jowl lines. So the other thing people commonly will do is fill in the volume of the lips, and for people that get smoker's lines, we can use Restylane Fine Line to help with that. So I'm going to show you what we're doing. Prior to you arriving, we did put a little bit of topical anesthetic on
it's like a light cream.
Yes, it's just a little bit of a cream for about a half an hour, just to reduce the chance of discomfort from the needle.
Here we go.
And, you know, as you can tell, she's really not feeling any discomfort from the needle. So with each injection, we are going to be filling in that area that is missing volume. So in this area, we do it in the cheeks, and it will start to restore the volume that she's lost. And we do a few different injections in this area. So we try and get the normal contour of the cheek, because as you can see here, the cheek goes from the bridge of the nose all the way out to the what we call the zygoma, and we want to bring that back up.
And as you just said, it's quite painless. I don't see her flinching at all.
No, Linda's actually a very good client, and the procedure itself really doesn't hurt that much because you're just simply putting in a little bit of fluid, and she is frozen already, which helps. So we do recommend people come about a half hour prior to their procedure so that they can get some of the freezing done.
Okay, and let's talk about the fluid for a second. What's actually inside that syringe?
This is hyaluronic acid. So in the olden days, you may remember hearing about collagen, which came from animal products. So unfortunately, people get allergic reactions and develop sensitivity to it. So the nice thing about hyaluronic acid is that it does not have the potential for allergic reactions. So that's a nice feature.
And actually, I've read that hyaluronic acid is also something that can be found in our bodies. Is that right?
Yes, hyaluronic acid actually occurs naturally in the skin. And as we age, unfortunately, the volume of hyaluronic acid drops. So what we're doing is we're restoring what is missing from the aging face. So this is what you used to have in your face all the time. Now we're just putting it back in.
Okay. How long does this procedure take? Are we going to be here for hours? Or?
No, the nice thing about Restylane is it's a lunch hour procedure. It's about a half an hour to
half
do.
An hour?
Yeah, to do a lower half face. And Botox is about 15 minutes, so it's a little quicker too. And she will walk out of here with maybe just a tiny little bit of mosquito bites on her skin, but she'll actually see the results right away, which is nice. Botox takes about 2 to 7 days to kick in, whereas Restylane will show the results right away, which is really good, because people sit up and they'll look in the mirror and they'll say, oh my goodness, you've just taken 10 years off my face, and it's beautiful.
Are there any side effects that we should know about when it comes to Botox or Restylane?
Well, Botox does have about a 15% chance of just a temporary headache, and that's not because of the Botox, that's just the needle going in. Restylane, Perlane, tiny little bit of bruising is possible. As you can see, Linda's not really bruising significantly. And the thing we tell you is not to do any alcohol or aspirin or Advil prior to coming in, because that does increase the chance of bruising.
Okay, we just have a couple of minutes left. I also want to ask, how long do the effects last?
Botox will work for about 3 to 4 months at the beginning, and then the longer you've done it, the longer it will last. And Restylane, Perlane will last on average 6 to 9 months. In areas that don't have a huge blood supply, it'll last a little bit longer, but most people will average about 6 to 9 months. But I've had some patients last as long as 12 months or a year, or 2 years actually.
Are there any dangers to prolonged treatment, over years?
No, that's the nice thing about the hyaluronic acid. It is the naturally occurring compound in your own skin, so it's completely safe.
Okay. And is there anything that we should know before coming to the office and sitting in a chair?
Well, you want to reduce your chance of bruising, so again, you don't want to be taking any aspirin or Advil or anything that's going to increase the chance of bruising, no red wine. But other than that, no, not at all. We do discuss any concerns you have or anything you need to do ahead at the consultation also.
And as you just said, you offer free consultations?
Yes, completely complimentary, and we can discuss each individual's concerns and their needs, because everybody has a different priority, and we want to address their concern.
Okay, and how can we contact you?
You can call us directly at 905-790-6644, or you can get us through the website, drmatta.com, and there's an email link there, and there's actually a lot of information that they can check. There's an FAQ section, before and after. All those things are on the website.
Thank you very much for joining me here today on Daytime.
A pleasure.
I'm at the Dr. Matta Cosmetic and Weight Loss Clinic in Brampton. That's it from here. It's back to you guys.
Cool, thanks, Brian. Would you do it?
Yeah.
Really?
I totally would.
I have to say that I was offered the Botox when I went to one of the New You show last year. I was kind of like, I don't know if I want to get it done already. I don't know if I'm that wrinkly already. So, but I think, you know what, when I do start seeing the wrinkles, especially maybe here, or on the side of the eyes, what's it called, the crow's feet?
The crow's feet?
I think I might get it done.
Yeah, I feel the same way. Like, I don't think right now I would do it, but I think if stuff starts falling and getting all wrinkly, I'm probably willing to do it. Not evasive stuff, like the stuff that they were talking about.
Yeah, like the Botox and the Restylane, just a little bit of needle prick. That's not so bad. Anything done in moderation, I think, is okay. So if you get some of that work done in moderation, I think you're probably okay. Yep, all right. Well, there you go. Coming up next on Daytime, we're going to chat about the 30-hour famine with Kevin Chan from World Vision Canada. So stay tuned for that. I know you've heard about it. We're going to tell you all about it when we come back.